Mazoji is a village on the outskirts of Daura in Katsina State, Nigeria. Farming and cattle rearing have been the way of life here for generations. Women like Naha Abdu work long, hard hours in the field. But Naha Abdu has a condition that makes life even more challenging. She is almost completely blind, and she is not the only one.
Some time back, I started noticing my eyelashes were itching and falling off. Whenever I pull it out, I feel relieved, but the pain is still there. Now I can hardly see.
It started a long time ago with itches in my eyelashes, and wherever I rub my eyes, it's always painful. And I cannot do anything right now because I cannot see.
This sickness is affecting a lot of people because it causes blindness. Some cannot even go to the farm or market as they used to do. Some cannot even read. Most people have to be guided to places, all because of trichiasis.
Trachoma is the commonest infectious cause of blindness in the world. 77% of the world population at risk of trachoma live in Africa. Part of this population reside in the trachoma belt, which stretches over the Sahel of West Africa, cutting across northern Nigeria.
Trachoma is an infection of the eye, and it is transmitted by flies, by fingers, and even by inanimate objects like your wrappers you use to clean your face, or even things like eyeliner. It usually starts in childhood, but with repeated infections leads to scarring of the eyelid and interning of the eyelash.
Trichiasis is as a result of chronic infection by trachoma. It's an chronic infective condition that, if left alone, will lead to irreversible blindness. So
in Nigeria, through recent surveys that were done, we found that we have close to 300,000 cases of trichiasis in the country. And in Katsina alone, there are over 30,000 cases of trichiasis. This shows how serious a problem this is, because what that means is that we have almost 30,000 people who have the potential of who are blind or have the potential of becoming blind from trichiasis.
Helen Keller International has been at the forefront in the fight against neglected tropical diseases. Following a grant from Queen Elizabeth Diamond Jubilee Trust aimed at tackling trichiasis amongst the disadvantaged and vulnerable in Katsina State, Helen Keller International has begun a process that will bring help to villagers like Naha Abdul.
The mission of Helen Keller International is to save the sight and lives of the most vulnerable. So for Helen Keller International, it's a priority to address this preventable cause of blindness. The overwhelming majority affected are women. Why is this so? Oftentimes, women are the ones who have to look after children who are infected with trachoma, the disease in its active form, and because of that, they also become infected. This is why Helen Keller International, in collaboration with the Queen Elizabeth Diamond Jubilee Trust and the Katsina State Ministry of Health, are working together to train eye health personnel, provide equipment and consumables to conduct TT surgeries in the state.
After the launch of the trichiasis surgery training in Daura, Katsina State in November 2014, Helen Keller International provided skilled trainers and surgical mannequins to train ophthalmic nurses to perform lead surgery in Daura General Hospital.
Just once, and you tie and cut.
We are training ophthalmic nurses and not doctors, because When we look at our manpower in the country, we have more numbers of ophthalmic nurses than ophthalmologists. And these ophthalmic nurses they render their services in the rural area, that's in the community.
We were given introduction what trachoma is, how to manage trachoma cases, how to assess a patient with trachoma and be able to diagnose that this patient is having trachoma.
There are things that we have not been doing correctly as far as this kind of surgery is concerned at General Hospital Katsina. So when we came here, they taught us those kind of things that we have been doing wrong. Like the kind of surgery we do. The kind of surgery we do there is called trabot surgery, while the one they're teaching us now is called bilamellar tarsal plate rotation.
This training has made me to be aware that there are some people there that really sympathize with the situation of these patients. From the training, I learned that is somebody that is sponsoring this program. So you see the kind-hearted people that really has sympathy on this sort of patients. That's what the training made me to be aware of.
At the end of the training, a trichiasis outreach was planned where the trainees were expected to undertake supervised live trichiasis surgeries. To select patients for this first set of surgeries, Helen Keller International organized community mobilization to create awareness in Daura and its environs. Potential patients were then screened for trichiasis and prepared for surgery.
Well, the mobilization is very encouraging from the various levels in the communities. There's a local government area, I think Bauri, where the local government focal person was telling us that right now she has a lot of cases that were identified for surgery. I think even exceeding the number that we are planning to operate for that particular local government area.
We get people, that is what we call them case finders. They go around the communities. Then we ask them to go also by house, so that even if you are in the market, if you didn't reach the market, the people that they meet in the house, they will tell them that there is one, but he's in the market. Then they used to go back and see that.
Helen Keller also undertook the equipping of operating rooms for the surgery. The surgical procedure undertaken is called bilamellar tarsal rotation operation. During the surgery, the portion of the eyelid containing the eyelashes is rotated outwards so that the eyelashes are no longer in contact with the cornea, and this position is secured with sutures. Over a 5-day period, the trainees undertook 124 trichiasis lead surgeries.
We have to do surgery to correct the eyelid, to turn it back to its position so that the eyelashes turn outward instead of inward.
Following the successful takeoff of its trichiasis surgery program, Helen Keller International plans to reach its target of 15,700 trichiasis surgeries in Katsina State and bring help closer to the people by organizing outreaches in more communities. They also plan to undertake training programs to grow the pool of trichiasis surgeons as well as maintain quality of surgery by constant supervision and monitoring of trainees.
You are the core of the surgery aspect.
By the end of this 4-year project, we hope to have carried out almost 16,000 trichiasis surgeries in Katsina State, which translates into a reduction of at least 65% of the burden of this disease.
By the end of this program, the Queen Elizabeth Diamond Jubilee Trust, in collaboration with Helen Keller International, would have brought rays of hope to communities and people like Naha Abdu.
So we would like to see more people living healthy, productive, longer lives because trichiasis would have been eradicated from their communities.
Helen Keller, I would say that they've done well by bringing this program to this part of the country. This is the first time we are having a complete approach to this disease control.
I am very much happy that Helen Keller bring this surgery and it is free. So thank you very much.
To ina kira ga wannan kungiya ta Helen Keller.
I want to say to Helen Keller to keep up the good work. They transport the affected patient to the hospital, do a free surgery, and transport them back home. We are very, very grateful.
Before now, I cannot see, but I can see clearly now after the surgery. Thank you very much.
After the surgery, I no longer have pains. I feel okay and I can see better. Thank you.